Come in.
Good morning, Miss Thomas. How you doing?
I'm good. How are you?
Nice to see you again. How you feeling?
I'm good. How are you?
I'm well. Thank you for asking. I was told that you wanted to do a focused abdominal assessment today. Is that right?
That is correct. Yep.
Very good. Thank you for trusting me to do it, to perform it.
Mm-hmm.
Listen, prior to starting, can we just get a verbal consent, consenting that you agree to doing this assessment online?
Yes, I consent.
Awesome. Well, without wasting any time, let's get you started. So what we'll have you do is just lean back. We're gonna have you comfortable. We have these wonderful pillows you can use. We'll just put your legs on this so we can relax your abdominal muscles.
Mm-hmm.
All right? I don't want you tensing up or feeling tight or anything like that, okay? And also what I have for you is I have a little drape, also known as a towel, that we'll just be putting over you. And do you mind me pulling down pulling up your shirt and pulling down your pants a little bit?
It's okay.
That's all right?
Yep.
All right, cool. So I'm just gonna, what I'll be doing is I'll just be pushing this down just a little bit so I can see your abdomen. When I see your abdomen is symmetrical, looking smooth. I'm sorry if my hands are a little cold. I don't see any discoloration in your skin. I'm very pleased to see that. Awesome. So what I'll be doing is I'll be using a tool, a little instrument I have. I'm just going to shine 10 gentle lights on your abdomen. So not like this, but I'm going to just pushing on the side. And what I'm looking at is, I'm looking for any herniations, which means like maybe a little bit of a weakness in your abdominal wall, which I don't see. Let's do this side. Likewise, I don't see any herniations or anything. I see your stomach kind of moving, which would indicate your abdomen moving a little bit, which would indicate peristalsis, all right? And then I'm looking at the middle right here, this linea alba, if you will, and I'm just looking for a little beat, if I see a beat or anything, and I do not see anything abnormal, which looks great. Awesome, very good. So now, since I'm done looking at it, what I'm gonna do is I'm just gonna listen to your abdomen, okay? And I'm gonna listen to all 4 quadrants. We're just gonna divide your abdomen in 4, okay, to make it super easy, all right? So I'm gonna be listening with the diaphragm and the bell, all right? And I'm gonna start at your right lower quadrant. And I hear bowel sounds, which sounds great. Right upper quadrant. Good. Normal active on both right upper and lower quadrants. Left upper quadrant, normal active. And normal active on the left lower quadrant. Beautiful. And while I'm here, I'm going to be listening to your aorta with diaphragm and bell, just above the umbilicus. I'm going to flip it. I don't hear any bruits or anything like that. While I'm here, I'm going to listen to your renal arteries. So about 2 centimeters above the umbilicus to the right and the left, with diaphragm and bell. Beautiful. I'm going to check the right side now, with diaphragm and bell. Excellent. I'm going to do the iliac arteries. Very good. And I'm going to check femoral, okay? So I'm just going to touch the inside of your leg, okay? Again with diaphragm and bell. And a nice strong beat in your femoral arteries. Beautiful. Sounds good. Now what I'm going to do is I'm just going to slightly percuss your abdomen, okay? So I'm just going to be making like little thumping sounds on your abdomen, okay?
Okay.
And what I'm doing is I'm just going to check for tympany, something called tympany, which is like a drum sound. and I'm checking for dullness, which is a dull sound, if you will. All right, so I'm looking for organ structures, and I'm just looking for anything that may be, I'm just looking for what's normal and what isn't normal, okay? So I'm gonna start percussing in the right lower quadrant, and I'm gonna come up little by little, and I hear timpani in the right lower quadrant. I'm gonna go up just past the umbilicus, go to the right upper quadrant, timpani, hearing timpani, and now I'm right at the base of the liver, and I am hearing a little bit of dullness. And while I'm here, I know that the liver kind of goes under the ribs as well, so I'm going to be going in between the ribs, not on the ribs, to be listening to the dullness to measure how big your liver is, okay? So just bear with me. Beautiful. So I have dullness, and I'm marking these 2 points, and I have a nice little measuring tape. Since I marked the 2 points with my fingers, I can measure the border of the liver, and it is about 5 centimeters, which is normal size. Beautiful. Now I'm going to go on to the left lower quadrant, and I feel timpani. Again, timpani. I'm going to go right above the umbilicus, and I'm going to go into the left upper quadrant. Timpani, timpani, timpani. I'm going to check for the spleen as well, but the spleen kind of hangs under the ribs. So I'm going to go in between the rib spaces and check for some dullness in the spleen, which I hear right here. Beautiful. Okay, sounds good. Now can you just take a deep breath in for me and hold it? And hold, and then check for dullness for the spleen, which I hear. Beautiful. And there's the dullness. Okay, you can breathe out. Awesome. Looks good. Now I'm just gonna put some pressure into all 4 quadrants, and then I'm gonna go and do it a little bit deeper, okay? So I'm gonna press, starting in your right lower quadrant, and it's while I'm here, I'm gonna check for rebound tenderness. So I'm gonna push a little light first, see where we're at. Everything feels fine. I don't feel any masses or anything, and I don't see any tenderness. I don't see you jumping. And now I'm just gonna push a little bit hard, really quick right here. Do you feel any pain when I do that?
No.
Beautiful. So I'm gonna continue with the light palpation up to the right upper quadrant now. I'm palpating the liver right now at this moment. Doesn't seem enlarged or engorged or anything like that. Beautiful. I don't feel any masses. Smooth up and down. All right, now I'm going to go to the left upper quadrant. I'm going to palpate. Beautiful, nice and light. Don't feel anything at all. I'm going to palpate a little bit harder starting at the right lower quadrant. Just a little bit harder. Might be a little bit uncomfortable, I'm sorry. Switch to the other side, to the left upper quadrant, palpate. Don't feel any masses or anything, which is beautiful. Not noting any tenderness. So do you feel any tenderness at all when I'm doing it?
No.
No? Perfect. Okay, sounds good. Now, I'm just gonna palpate the spleen a little bit. So take a deep breath in and hold it. And, and while I'm palpating the spleen, or trying to at least, I don't feel any, you can breathe out. I don't feel any, abnormal large organs or anything like that while doing so. Beautiful. Okay, so right now I'm gonna check while I'm palpating. I'm just gonna check your gallbladder, okay? So we're gonna do the Murphy sign. So if you will, just take a nice deep breath in, and I'm gonna stick my fingers under your ribs. And if you feel any sharp pains, let me know. No sharp pains? Beautiful. Breathe out. Awesome. Let's do that one more time. And I'm gonna dig a little deeper. Any sharp pain? Beautiful. Okay, breathe out. Awesome. Excellent. Now, while I'm here, I'm just gonna kind of palpate your right kidney since it hangs lower than your left, okay? And then what we'll do is see if we feel any mass. So just take a nice deep breath in, and then take a deep breath out. And when you're breathing out, hold it. Beautiful. I can kind of palpate the kidney, which is right there. Beautiful. Okay, relax. And then we're gonna palpate the left kidney if we can get it, okay? So take a nice deep breath in. And deep breath out. Beautiful. Any tenderness at all? Beautiful. You know what? I also wanted to, I'm sorry, I completely forgot something. We're gonna check your bladder as well, okay? Since your bladder's right here, we're gonna do some percussion in your bladder, okay? I'm just gonna put my hand right here. And I hear timpani. Did you just use the restroom? Beautiful,
Yes.
okay. Hence why you have some timpani. Okay, very good. Now I'm just looking at your abdomen again. It's looking nice and smooth. It's looking good. All right, I'm gonna do another test on you. I know you don't drink alcohol because you mentioned you don't. And but let's just do it for some educational purposes, all right? If you will, can you just hold your hand right here at the midline? Beautiful. And what I'm gonna do is, I'm gonna have one hand over here on the left-hand side. I'm gonna use my right hand as a catalyst or to initiate some type of force. I'm gonna hang my left hand at your right side of the body. I'm not gonna stick my hand there, I'm just gonna have a little bit of space, almost like this, okay? Lightly touch. And what I'm gonna do is when I move this side, I'm gonna check to see if there's a flow or almost like a sound wave, if you will, to see if there's any water or fluid collecting in your abdomen, okay? Ready? So wait, 1, 2, 3. And I don't see any. Let's just do the other side just in case, okay? And I don't see any. Beautiful. You can rest your hand. Awesome. So I'm just gonna put your shirt down. We can put your pants back up. Okay, and I just want to check your kidneys on your backside, okay? So I'll take this off. So if you will, just take a seat for me. I'm liking the way this is going. I don't see anything abnormal, okay? And what I'm gonna do is I'm gonna check for CVA tenderness, all right? So it's called costal vertebral angle, which is the termination of your floating ribs, okay? So your ribs don't go all the way down. There's a little space here where there's no ribs. And in between that space, we have the end of the ribs, floating ribs, and we have your iliac crest is right here. So your CVA, which is right here, when I hit on it, or when I tap it, if there's any tenderness, I want you to let me know, okay? That would be indicative of some, maybe perhaps some kidney problems, okay? Could be many kidney things, okay? All right, so I'm gonna lightly tap. I'm gonna start from the top and go down slowly and tell me if there's any tenderness.
No.
Beautiful. Let's start from the top, go down slowly. Any tenderness?
No.
Beautiful. And you said you're voiding well, no problems, no burning, none of that, correct?
Correct.
Awesome. Well, thank you so much. I'd like to tell you that everything looks good. You checked out pretty well.
Thank you.
And we have another assessment to do later on, okay? Thank you so much for being such a good patient. I appreciate that.